the coronavirus pandemic is said to have stopped 20 years of progress toward the achievement of the United Nations Sustainable Development Goals. That's according to the Bill and Melinda Gates Foundation's 4th annual Goalkeepers Report. Natalie Africa from the foundation is chatting to us now about the ripple effects COVID-19 has had on progress, on development in Africa. Natalie, good morning. Thank you very much for your time on this Friday morning on ENCA. Just reading the press release the other day that the foundation has sent out about the Goalkeepers Report, I just got a sense that it looks like, good steps, like one powerful step was taken forward, but we've gone back like 4 or 5.
Unfortunately, Dan, that is true. What's amazing is that it takes such a short time to erase progress that has been made over years. So if you look at, for example, poverty, just since the coronavirus, we've seen that the world has increased 7% in terms of poverty, whereas over the last 20 years, there was a steady decline in global poverty. That translates in Africa to about 30 million people who will be living in extreme poverty by the end of the year, possibly more. If you look at vaccinations, we've erased 25 years of childhood immunizations in just 25 weeks. So it's amazing how fast progress can be erased.
Yeah, and what also comes through this report is that where there's also been progress made in fighting against certain diseases like malaria in Africa. I was chatting to Goodbye Malaria just a few weeks ago, and also about how the Global Fund has sort of been redirected to the fight against COVID-19. You see that even the fight against some diseases like malaria in Africa have been set back big time.
That's right, Dan. In the last few years, the global health community has been talking about getting to eradication of malaria. But just since COVID started, we've seen that 5 years of gains in the fight against malaria have been wiped out. So it means that we're going to need to double up and do even more to be able to recoup some of the losses that we've seen over the COVID pandemic.
Yeah, and sadly, even in 2020, we're saying these women and other vulnerable groups like children are disproportionately affected and suffering. And we expect children, millions of children in Africa are going to die because of their help is not there in terms of the risk from preventable diseases.
That's right. I think what we're going to see is the lack of childhood immunization because parents haven't been taking their children to hospitals. So children are going to succumb to some of those childhood diseases like measles and so on, which were nearly eliminated in most countries. We're also seeing a huge problem with malnutrition because parents have not had money to feed their children. 86% of workers in Africa work in the informal economy. Once they were locked down and they couldn't go out and, find a way to earn their living, within the first month, most people said they were unable to buy food.
Yeah, we've seen, according to the report, we've seen some best examples, shining examples of the best of us as human beings, the best of humanity. There's also been some good stuff happening in terms of innovation on the continent. So it's all not doom and gloom. But as you said in the beginning, we are going to have to double up. That means as well there's going to have to be better partnerships, collaboration between the private sector and governments.
That's correct. And some of the innovations that we have seen during this time have stemmed from public-private collaboration. If you look at the Africa Medical Supplies platform that has been launched by the AU with support of President Ramaphosa, that came up within just a few weeks, and what it created was a marketplace for African countries to be able to access PPPs, therapeutics, diagnostics, things they couldn't access on the global market. Within countries, we've also seen wonderful public-private partnerships. Here in South Africa, the foundation has supported some work with Uber to be able to deliver chronic medicine to people who couldn't go to hospital because it wasn't safe for them to get their chronic medicine. So that was a great public-private partnership between provincial departments and the company Uber and other transport companies. So if we can continue to do things like that, make them the norm, it'll make it much easier for us to recoup some of the losses that we've seen during COVID.
Yeah, what would the Bill and Melinda Gates Foundation's view be on this fact that Oxfam, and my colleague Yuveka just a short while ago, we interviewed Oxfam, and they are flagging that rich countries are buying up vaccines and that the middle income and poor countries, and most of them we know are in Africa, are going to suffer if and when the vaccine against COVID-19 is found. What's the foundation's position on this?
We have a very strong position on this, Dan. The foundation's mandate is to make sure that all lives have equal value. For us to see that the vaccine may be, given to rich countries and not poor countries means, one, that we're not treating people equitably, but it also means that we will be in the disease of COVID for much longer, because our estimates have shown that if the vaccine only goes to rich countries in the initial phases, there may be double the amount of deaths that could otherwise be averted if it was distributed equitably, because of the fact that poorer countries won't be able to manage the virus and they'll continue to be tackling it for much longer. So we are working with a global initiative called ACTA. It means Access to COVID Tools Accelerator, and we're trying to ensure that partners, pharmaceutical companies, countries, donors all come together to try and make sure that prices for vaccines are affordable for poorer countries and that enough doses are allocated to poorer countries.
Are they listening?
We will try and make sure they do. We believe that that is our job and that is our philosophy, and I believe that there are a lot of committed people who are trying to do this. We are also encouraging manufacturing in developing countries. We're working, for example, with the Serum Institute of India that has a high capacity for manufacturing vaccines to try and ensure that they have the ability to produce for other developing countries as well.
Natalie Africa, thank you very much. She's, of course, from the Bill and Melinda Gates Foundation, talking to us about the insights coming out of the 4th annual Goalkeepers Report.